You're supposed to give me a thumbs up, man. My name's Paul Siffri. I am a sports medicine specialist with Stebbin Hawkins, specializing in knee and shoulder surgery.
Okay, Dr. Paul Siffri. So, we've been here chatting with you for a little while now, and so can you describe one or two problems that you might experience with medical equipment in a clinical setting?
Sure. I think one of the things that's unique to the orthopedic practice and most orthopedic surgeons is the need to view images, whether it's x-ray images, CT scans, or MRI scans. And we have a PACS system that archives our images so we can view them with the patient in the room, which is a nice feature because the patients in today's world are more interactive and play a larger role and a more active role in their healthcare. So if we're able to show them the images and discuss things with them, it makes them more educated and helps them make good educated decisions. And it helps them play a more active role in their care. The problem we have sometimes in the clinical setting is we're a very big university medical center. We have 5 or so offices spread out throughout Greenville and even outside of Greenville. And we all have we utilize one archiving system. The problem is new images come into the system, old images get put into an archive, and if a patient comes back, let's say I haven't seen a patient for 8 to 10, 12 months, and they come back and I want to retrieve their images to go over it with them, oftentimes they are in this archive box, and it takes quite some time, 5-10 minutes, sometimes more, to retrieve them so I can show them. The problem with that in the clinical setting is it really kills our efficiency. We're seeing 25 patients in a half day, and even 10 minutes of a delay can really affect the efficiencies, and quite frankly it affects patient care. The patients are frustrated that they have to wait longer, and it makes them question the system when something as easy as viewing an x-ray becomes a problem.
Okay. And can you just go ahead and describe any problem that you might experience in the OR setting?
Well, sure. It's not dissimilar from what we just spoke about. One of the unique things that we like to do in the operating room, especially when we do arthroscopic procedures, is we take pictures of the pathology. In other words, let's say I'm doing a knee scope, and I can take a picture of a torn meniscus and then take a picture of the torn meniscus once I fix it. And it's nice to have those for the medical record, which is probably the most important part of having those images for a complete medical record, but also because then I can show the patients their pathology. What happens is the images that are taken in the operating room will then get transferred to the PACS system, which is the archiving system I told you about. Well, somewhere in the transfer from the operating room to the PACS system that we utilize in our office, those images will get scrambled out of order, they'll get duplicated, and so again, it affects our ability to show the patients in the office their pictures, what we did at surgery, and again, it cuts down on efficiency, and again, it's part of the medical record, and so whenever it's part of the medical record, it's a legal document as well, and there can be issues there as well.
When we were in the OR, we noticed that there would be some problem every now and then with the bone drill running out of energy. Is that a frequent problem in the OR?
Yeah, it's not uncommon. I mean, we're doing a lot of bone cutting, and it does require power tools. We're nothing but glorified carpenters, and so the good thing about the medical system in the United States is every medical device that's utilized goes through a governmental agency called the FDA, Federal Drug Administration, and has to be approved. So it's a complex system. So any tool or instrument we use in the operating room has been through a rigorous screening, if you will. And you juxtapose this against, in Europe, for instance, they don't have this regulating agency. So there's pluses in that, you can go to Europe and maybe get a newer implant or a newer device that we can't use in the United States because it's not been through the approval system. But one of the things, as you alluded to, with the drills and the power tools we use, is they're run on battery supply. And those batteries are sterile, and they go through sterile processing. And we can't use unsterile batteries. So if I run out of power in the middle of a surgical case, and they don't have a sterile battery that's easily accessible, ready for me to use, then we're in a little bit of trouble. So we got to determine how we can utilize or obtain batteries that can stay charged longer after going through the sterilization process. Does that make sense?
Yes, sir.
Yeah.
And that's all we have for you today. Thank you for your
Great.
time.
Sure.
Sweet.